One of the main reasons for including ligament in these lectures is one, just to increase your understanding of joint anatomy and its related structures beyond just the muscles, but also because sometimes pain that may come across as musculotendinous can actually be ligamentous. We're picking the lateral collateral ligament and its associated injuries because it is closely related to that iliotibial band. And as you might be able to tell here, one of the unique things about the LCL is it is extracapsular, which means that most of your ligaments are found or woven into the joint capsule, but this is one that even with, say, an x-ray, you would be able to see it outside of the joint capsule. Now, when you look at damage to a ligament, you're looking at some level of direct trauma, and we are looking for traumas that our clients run into that create varus forces, so impacts to the outside, the inside of the knee that would push the knee away from the midline, creating a varus force, and lengthening this ligament out would be a situation that would create stress here. So sports like soccer or lacrosse, where these kinds of injuries where impact can come to the inside, are the kind of things where you're going to run into these. And even when they're minor, or rugby is another one that comes to mind, minor sprains to these ligaments will still keep them out of a doctor's office, but will generate pain in the lateral knee. A couple things to keep in mind. One, was there an MOI, a moment of impact or a moment of injury? The pain that they feel is usually present on the lateral knee, very specific to that lateral knee, and they may complain of things like instability in the knee when they're doing twisting or, like a cutting kind of motion where they're planting and going explosively. They'll feel a little bit unstable. So when you hear that kind of talk, you need to begin to think about the role that ligament injury might play. With injury, you're going to develop a little bit of laxity here. So we're going to go over an orthopedic test called in this case, we would want to do a varus stress orthopedic test to see if there is any pain elicited in that motion. And that would be positive for potentially looking deeper into lateral collateral ligament damage. Again, this is not terribly uncommon. Anybody that is involved in an active sport has the potential for injury in this area, but they would need to have some sort of MRI done to verify this. Palpation of this ligament, again, it's extracapsular, so you can palpate it, and it will be tender to touch. And when this happens, you're looking at some level of rehabilitative therapy. As far as the muscular structures are concerned, supporting this would just require looking at things like the hip, knee, and ankle, and increasing the biomechanical capacity to take the load in those areas.